Today is Thursday, May 30th, and welcome to the COVID-19 Task Force Daily Update. I'd like to thank Neil McCumber for filling in yesterday as I took a day off. I should say the illustrious Neil McCumber did a good job. Today on the program, Lisa Westaway and Arnold Lazare will be joining us. And starting off, though, a very, very busy lady. As you know, the Kahnawake Economic Relief Measures Fund has been established and actually has kept Alexis and her crew very busy. She's joining us on the program today. How are you, Alexis?
I'm doing well. How are you?
Not too bad, not too bad. I know you've been very, very busy. We heard Paul Rice on K1037 this morning talking about the volume of people and some of the measures that you're taking to deal with how busy it's been. So tell us what's going on and just how are you dealing with so many calls?
Well, so far we've had about just over 900 people who have been enrolled in this fund, and this fund was instituted very quickly. It's been within about 3 weeks that we've had that many people put onto the program. The program was created very much on the fly, and it's an alternative to the CERB and for people who were not eligible for CERB. CERB has been changing its rules and its eligibilities recently, so it's hard to keep up with exactly who's eligible for what at the moment. But we did try our best to put together a graphic, and we have that on the website that says, it's the graphic saying economic benefits available to Kahnawake. So we did say those that are eligible for individuals or for businesses, just the different things that people were able to get. But at the bottom of the graphic was a statement just saying that individuals should only access one program for funding, if that was EI or CERB or the Kahnawake Fund or social assistance. So we did straightforward have that on there, but people were calling in several times saying, I've received CERB and I have the KERM fund, what do I do now? So if people find themselves in this situation, we're asking that they contact CBS, and we will be discussing their options with them, because some people are entitled to CERB, and in that case, they would refund Kahnawak's program. But in some instances, they may not be eligible through CERB, so we would like to discuss this with them and discuss their options.
Yeah, I guess the key here is trying to make sure everyone who has an issue is addressed, because there are, some people didn't pay into employment insurance, for example. Others may not have been, able to get social assistance. So really the Kahnawake Fund was to try and find a way to help those who fell between the cracks, sort of, right?
That's right.
Mm-hmm.
That's
so
right.
in this case
yes,
now,
for those,
go ahead.
For those who didn't have a T4 for their last income tax year, that's when they would have gone on to this program.
Mm-hmm. So with, I guess there are always going to be people who are not sure of what their options are. I guess you guys are taking a lot of calls from people just trying to make sure that they're covered off and they will receive some monies. First of all, how long is it taking for people to get service when they call?
The thing was, we had calls all the way up. We're still actually making calls. We reached out to everyone who left their numbers. The thing was, some people, either we had the number written incorrectly or they just did not answer their phone. So that's why we wouldn't have reached them at this point. But for the most part, we've reached out to everyone who left their number with us. Mm-hmm. And we went to the extent of calling people 3 and 4 times if they called us and left their number that many times. So we had to apologize when that happened, but we just didn't want anyone to fall through the cracks and be left without.
Okay, so that number again at your office is 450-638-0500. We'll reiterate that to our viewers and listeners. So even though there are a lot of people calling, I guess more than originally anticipated, everybody who calls, though, is getting a call back.
Yes, absolutely.
So is there anything else you have to add before I let you get off to preparing your supper?
No, I think that's everything. If anybody has any questions, they can just reach out to us.
All right, Alexis Shackleton, the Director of Client-Based Services at the Mohawk Council of Kahnawake. Thank you very, very much. And I also wanted to just correct something. I said off the top of the program, it's Thursday, May 30th. It's April 30th. I know we're getting days, months, and almost the whole year mixed up, but just to be clear, today is Thursday, April 30th, the last day of the month. All right, joining us now to talk about the latest initiative at the Cattery Memorial Hospital Center. It got underway today. People are already receiving phone calls, so let's invite Lisa Westaway, the Executive Director at KMHC, to tell us about it. Lisa?
Thank you. I have a very quick update today. I just wanted to let you know that in total we were able to reach 66 people. So we did 66 health checks today. And in fact, we brought in 7 people to the drive-through testing site for appointments today, simply from having spoken with you in the health check. So that's really wonderful news. We also had 9 people who called in to give us their cell number, so it shows to me that you guys are listening, and I really appreciate that. So we urge you to continue again tomorrow to answer your phones, to call us, to give us your cell numbers, and we're going to continue to do this initiative, which already from today is quite promising. So the idea is to reach as many people as we can, to do the health checks and test as many people as we can as well. I just wanted to give a little, just a little warning. I know Legault has been talking often every day in his updates about the openings as of May 11th that are coming our way. I think it's important to note that he mentioned today, and I'd like to mention it as well, that these openings will be done while maintaining social distancing. And so even with the increase in contacts that opening up certain businesses or schools will entail, so he's expecting 10 to 20% of increased contacts, we still expect due to that to see increased death, and they are predicting that and preparing for that. So that's a very good reason why we're not ready yet to open up here. However, the important point that I wanted to highlight was the importance of maintaining social distancing, of washing your hands, and of practicing your safe hygiene measures. So we urge you to continue with those measures as we move forward. So that's my update for today, and I'll have more updates tomorrow regarding the testing site. Thanks.
All right, and thank you so much, Lisa. And our final speaker today, our final presenter, is a member of the COVID-19 task force. He has been on several times. So let us welcome Arnold Lazare. Arnold.
Good afternoon. Yesterday, we used the analogy of the task force driving a bus with half the people wanting us to go faster and half the people wanting us to stop. I'm going to change it a bit today. It's kind of like having to work on a motor while the motor's still running, and there's 15, 20 people from Kahnawake watching you. Everybody knows that when you start a project in Kahnawake, you have 2 or 3 people working and 15 evaluators, and they all know better. Now, with Legault making all his claims, we often get pulled in different directions. And so it's often frustrating for us. So we will continue to work on the motor to the best of our ability. The good thing is we've been consistent in what we've been saying, and we are still reaping the benefits. The numbers for Kahnawake are very excellent. No hospitalizations, no deaths, and that's the goal that we're continuing. Just a slight note, we understand that New York is opening up, and many of the iron workers are going to be going back to work, or either have to or choose to. We would like to remind them that the directive of people coming in from New York is still in effect. New York is one of the hot spots, and the last thing we want is someone bringing a positive from New York. So we just friendly reminder to the iron workers, If you do choose to go back, which is your prerogative, the directive would say you'd have to self-isolate, which means stay away from your family for at least 2 weeks. And it doesn't make much common sense to come back 2 days if you're going to spend the time in your self-isolation room. So we trust that they will make wise decisions and keep the community safe. The second item is with the Legault announcing daycares and education, we are aware that Step by Step is going to be contacting all of its parents and its staff and employees. So we would ask people to be on a lookout. Step by Step is looking to see what people's intentions are so they can do appropriate planning. On behalf of the task force, we have a nice weekend coming up. The weather's supposed to be nice. That's going to make it additionally frustrating. But once again, we're asking, we're urging, we're begging you to be patient. We are going to get through this Kahnawake, and we'll have a good weekend. Take some good social distancing events, walk, bike, run, but do it in a safe way. Have a good weekend.
Thanks, Arnold, and don't forget the bullheads probably will be biting this weekend, so keep the fires small and keep some water nearby. Make sure you shut it down when you're done and enjoy yourself. Just a couple of notes here before we leave. Mentioned this the other day. KSCS has a program where if you're having problems, anxiety, just difficulty dealing with the current situation, they have a program called Let's Talk Kahnawake, and you can call anytime from 5 to 8 p.m. from Monday to Thursday. So tonight you can call till 8 p.m. at 514-235-9607, and you can speak to somebody directly. They also have people on standby actually 24 hours a day. So if you're troubled and you need to call somebody, what you do is you call the Kahnawake Peacekeepers at 450-632-6505, and they will put you in touch with someone. But again, that program specifically, Let's Talk Kahnawake, is open from 5 till 8, Monday to Thursday. Also, just wanted to mention the Cleanup Challenge was a real nice success. It ended on Sunday. Today they announced the people who participated. Lots of winners. We'd like to thank the people who donated and all of the organizers here, Kahnawake's Waste Management, for this really nice initiative. And we'd like to hope that it continues. Of course, this year the Eastern Door couldn't do its usual cleanup because of this, but at least we got something done to help clean up the town and make it look as beautiful as it should. Just wanted to mention too, I spoke to Michael Rice, my old friend, and he and his son were out on the other side on the north wall of the Seaway, and no one over there really cleans up too much, so they took it upon themselves to clean up a bit. They got 5 bags full of cans and bottles and stuff like that, and they just welcome anybody else who wants to kind of go out there and volunteer and do it, because you will feel better about yourself, because so many people are looking for something to do right now, those who aren't working. There are things you can do to make your community a better one, and that's just an idea that those guys had, and it's been a good one. So with that, join us tomorrow. We'll have a full slate of guests on the program for the daily COVID-19 Task Force update. So on behalf of all of us here at the Task Force, we'd like to thank you for watching, and we'll see you tomorrow. Nyao ko adano, onigiwahi.